a new person in the health space, right? So I'd like you to ask your neighbor a question. Have you invested? Can you just ask your neighbor? And it's a bit personal, but it will be a conversation starter. Would you just ask them if they've invested in something? It doesn't have to be money, but just, something. I can see some people not speaking to their neighbors. If your neighbor is nonchalant, feel free to move now. You're stuck with them the whole of the, session. So feel free to move.
Have you invested?
Me, okay, I'll whisper because they can hear us. Okay, I can see some people becoming investment partners after this. Amazing. So we're gonna be having some lunch breaks in between, tea breaks in between. I think it's turning to be a passion project.
Oh yeah.
The investment part.
Yeah.
Okay.
This is AHB, Africa Health Business. So all investors in healthcare, you're welcome.
Amazing. So those who are coming in right now, please have some seats because we're just about to start. We were talking about investing.
Yeah.
And that's because we'll be talking a lot on health as an investment. So it's easier to probably have that discussion when we know what investing looks like.
Very good. By all means, one of the things that we want to do is that we want to go paperless. So we don't want to waste our forest cover. We are scientists. We know what that means for the environment. So for you to access the program, on your name tag, there's a QR code that you can scan. As you can see, Dr. Bridget is showing you. You can scan the QR code and you'll access the entire program for today. So feel free to scan that and you'll have access to everything we'll be doing here. For you, the program will be going on unannounced. Anyone who doesn't scan that, they'll have to listen to us, right? We'd love you to listen to us.
Oh, I think they're pleased to listen to us. Amazing. So as people are settling down, we wanted to try out a bit of a quiz to jog our minds. Jeremiah, are we ready?
So, we'd like you to be very interactive with us. Like we said, it's paperless. We are going paperless, so kindly be very interactive with us. We have a QR code here that we'd like you to scan. It's called a Mentimeter, and this is a platform through which we are all going to engage. So kindly take out your phones, and let us get. We already have 5 respondents, 7, 8, 9. Let's keep going. The room is full. If we can get to like 25, we could be good to go. But everyone, please join. You can scan that, and then we can, good to go. We are at 25. So, who is in the room? Where does your passport or your ID say you come from? Welcome South Africa, welcome USA, welcome Finland, from Poland, welcome Rwanda, welcome Germany. If you're from Kenya, I would like you to do something special. And this allows you to give multiple responses, okay? So if you're from Kenya, tell us where the back of your ID says you come from. The back of your ID, where does it say you come from? We have Ekechuku, Arthur, Anoke. May I use my wildest imagination and say that is a brother from Nigeria. We have Dr. Sheila Macharia is in the room. Who is in the room? Where does the back of your ID say you come from? Okay, very good. Someone comes from Earth. The rest of you, I don't know where you come from. But one of us comes from Earth. Very good. We already have 65 respondents and counting. 57, there we go. 58 and counting. We have someone who's just from here, Elmara. We have Honduras, welcome. We have Trinidad and Tobago, welcome. We have Ngobile from South Africa. I was in Cape Town the other day. Wow, it's a beautiful place. We have someone from Kapsabet, from Kisumu. Well. We have someone from Uganda, from Mali. We have someone from Siaya, Kericho, Eldoret is in the house. Muranga, welcome. Our cousins from Muranga are here. We have Afghanistan, welcome. London, UK, Switzerland. We have someone from Wagoro village. We have Jackie from Meru. We have Siaya, Tula. We have Magadi, Mashishi, very good, very good, very good. We have someone from Bungoma, very good. We have Dr. Ebongo Zakius Nanji from Cameroon. This is from the Ministry of Public Health. Thank you very much.
Amazing.
Can we have the next question, please? Next. Aha. Now, this is a bit of, it requires you to use a bit of your
Now we're getting to
science.
the serious side.
So, what percentage of Africa's GDP is lost annually due to poor health? What percentage? Poor health. There's a tie. 10% has taken up. 15%. 7, 12. 15% is leading. There's actually an accurate answer somewhere, but let's see. What percentage of Africa's GDP is lost annually due to poor health? 22 of us think it is 15%. Only 7 think it's 10%. 1 thinks it's 5, and nobody thinks it's 2%. 27 think it's 15%. Okay, just to help us. What's the answer?
The answer is 10%.
Whoa!
I hope
7
maybe
of us.
we can have a little bit of faith in Africa once
yeah.
we're coming from here. But it's 10%. But 10% is a big number to be lost, right? Amazing.
Ladies and gentlemen, we have our guest of honor has just arrived, and let us allow us to settle in as we are just about to kick off the program. Thank you very much, Your Excellency, the Minister for Health, who is our guest of honor for today.
Yeah.
We are glad to have you and everyone in the program.
Amazing.
Let us be upstanding for the national anthem.
Good morning. Oh my goodness. Awkward. Okay, Jumbo Jumbo. So I'd like to first say thank you to all of you for making the time to come here. I'm saying all this so that we can settle in and actually start.
My work is to open and close people's brains and spinal cords. That's my day job. On the sides, however, I enjoy art, and here we are.
And we'll be your co-hosts for the whole symposium. So it's a So we've lined up amazing speakers for the whole of the symposium, and I'm pretty sure we're going to have really amazing engagement. And we have some great news.
Good morning, everybody. It's my pleasure to welcome you here. Good morning, honorable ministers. Very happy to have you here and honored. Amit, happy to have you with here. Still very happy. I'd also like to acknowledge Nishitcha, who we founded the company with in 2016. Before I start, I just want to share a bit of a backstory of how we started AHP in 2015, actually. We were working in private health sector strengthening. Everybody knows of it. Was doing work in federations, and from there we saw the need we could do so much more at a Pan-African level, strengthening public-private dialogue, bringing voices together, bringing people together, bringing ideas together, innovation, solutions, and bringing knowledge together. And that is what we've been doing since 2016. Actually here in Nairobi at the Safari Park, other side of town. We moved to the other side of town now. But it's been an amazing journey of growth, opportunities, challenges as well, as any company has when you grow. But we're very grateful for the partnerships that we've been having over the years, some since the beginning, some new, some even for the first time this year, and we're just grateful for that journey, and we're grateful for the support that we've been having from everybody, including our team that has been growing from basically me, Nishit, Amit, to now a team of 35 team members that we're having here in Nairobi, and team members spread over the continent in the countries that we are not present. I don't want to take up too much time because I have prominent and eminent speakers after me, but I want to show you a bit of a journey of AHB beyond the symposium, beyond the roundtables, what you might see on our LinkedIn's, on our socials, on our website. We're doing a lot of other work as well, technical implementation work, return on investment studies, cost effectiveness, and we have a bit of a video prepared over the past 10 years, and I think that will do better than me talking about it instead of you can see. So over to the video, then I'll come back. Thank you. Thank you, everybody. I think that did better than me talking for 4 minutes. You're seeing, it's real what we're doing. I want to bring back up Tom, but if you've seen something that interested you, the Coalition for Women's Health in Africa, or Coalition for Blood in Africa, market access, market shaping, we have our whole team here because it's a home game that we're playing in Nairobi. So please don't hesitate to reach out to any of us. I don't know if HB team that is in the room can bring their hands up. We're all here and excited to partner with you, do more, explore more. Welcome to our symposium. We're looking forward to the coming 2 days ahead. Great networking, great connections, great knowledge. And it's my honor and pleasure to hand it back to the moderator, to the MC.
Thank you.
Karibuni, everybody.
Thank you very much. Thank you very much. Have we not seen the video and seen how impactful Africa Health Business has been? So we're going to give them a better clap. But this is how we're going to clap. It's going to rise like rainfall, okay? So we start slowly, and then as I raise my hand, the intensity increases until the peak. That is where it creases, okay? So it increases until it creases at the peak, okay? Increases, I'm not making an error. It increases until it what? Creases at the peak. So let's start. Thank you. Thank you very much. That's for Africa Health Business. This highly impactful conference has been organized by AHB and the Ministry of Health Kenya. Now, our next speaker is Dr. Gakombe, who is the founder and CEO of the Metropolitan Hospital. He's also the chairman of the Kenya Health Federation. And I would like to invite him up front, and let us clap for him until he takes the microphone.
Ladies and gentlemen, on behalf of the Kenya Healthcare Federation and on behalf of the Kenya Private Sector Alliance, I wish to welcome you to our beautiful country, Kenya. I'm sure our CEOs will speak to you, but I stand here to say that healthcare in Kenya, right from inception, has been a partnership between state and the private sector. Whether that private sector is non-profit or for-profit, and the for-profit subsector is growing, it's always been a partnership. Whether we are talking about training or human resources for health, or we are talking about healthcare delivery, or we are talking about supply chain management. And for that partnership to work, it is necessary to have coordination mechanisms. And in Kenya, we have robust coordination mechanisms so that excellence about the challenges that we face in boardrooms and in spaces like this. And by so doing, we can not only attract additional resources into healthcare, and we therefore have to do everything possible to utilize those resources that are available extremely well. So the Kenya Healthcare Federation, which Dr. Amit is among one of the founders, with I and others, the Kenya Private Sector Alliance, of which I'm a founder member, bring together the private sector so that when we engage with government, it's a meaningful engagement. For example, the Kenya Healthcare Ministerial level, so that matters healthcare are resolved at his office. But should we find that there are matters that are beyond us, either because there is a difference of opinion or victors in the private sector, and engages through a presidential roundtable to resolve those matters that are cross-cutting. And if that is not enough, we also, so this is a model that AHB, which is a proud member of the Kenya Healthcare Federation, has been very keen to export right across Africa. We started with the Kenya Healthcare Federation, we went to regional federations, and we encourage everybody from across the continent at ways in which the state, the government, and the private sector can work together to drive an all-of-country approach. And if you recall what happened during COVID-19, in the absence of an all-together, it was not possible to achieve what we have achieved. So we as a country are proud to host you. We are proud and happy to share everything we know. We will share the results, and we continue to act as a linchpin, as a big more effort to keep up. But we'd like you to keep up with us so that no one is left behind. Karibuni, and thank you.
Next stage, I would like to call upon Dr. Abderrahmane Diallo, who is the Director of Program Management at the World Health Organization Regional Office for Africa. Could you clap for him as he's coming to the stage?
My dear brother, the Honorable Cabinets of Member States, Dr. Amit Thakur, distinguished representatives from the private sector, development partners, financial institutions, academia, and civil society. Ladies and gentlemen, it is a great honor to join you at this landmark 10th anniversary of the Africa Health Business Summit. Health as an investment, powering impact, sustainability, and economic growth in Africa comes at a defining moment. Because today, we are not only asking what and with impact. And this is where our collective responsibility begins. Across the continent, we are already seeing tangible and sustaining out-of-pocket spending below 5%, while others expand national insurance schemes. Public investment in health is increasing, even under fiscal pressure, exceeding $86 per capita, the benchmark for basic services. Local production is advancing, with pharmaceutical market share reaching 82% in Algeria, 36% in Ethiopia, and 30% in South Africa. Regulatory systems are strengthening, with countries reaching WHO maturity level 3 and increasing from 1 in 2018 to 9 by 2025. These are not incremental gains. They signal a continent in transition, one that is repositioning health as a driver for economic transformation. But let me be clear, the challenge is still urgent. At WHO Afro, we are intentionally shifting from conversation to implementation, from ambition to investment-ready action. Through the Health Impact Investment Platform, we are helping countries transform national plans into bankable investment pipelines, mobilizing over $30 million already and targeting $1.5 billion financing for primary health care. We have convened regional financing dialogues across 28 countries, bringing together governments, development banks, and private investors to align financing and unlock new solutions. And through the regional framework on local production 2025-2035, we are supporting countries to build resilient, self-reliant health systems linked to economic growth. This is the shift we are driving, from fragmented efforts to coherent investment-driven systems. Allow me to highlight 3 key messages. First, health is not a cost. It is a high-impact investment. An investment in human capital, productivity, stability, and long-term economic growth. Second, sustainability must be built from within. We need domestically driven, efficient, and well-governed financing systems anchored supporting innovation, innovative financing and blended models, investing in primary healthcare and prevention, building strong regulatory and manufacturing ecosystems, ensuring every dollar spent delivers measurable impact. But above all, it requires alignment. Alignment between governments, partners, and the private sector. Alignment around country priorities, not fragmented interests. Africa stands at a decisive moment. The question is no longer how strategically and how collectively we choose to do so. WHO, we are committed to working this. We will not only build together strong health systems, but we will unlock the full economic and human potential for our years. Ladies and gentlemen, with action. Thank you very much.
Thank you so much. And what he said. We have a video from Dr. Tedros Adhanom, who's the Director General for the World Health Organization, just to say hi quickly.
The Honorable Minister Adam Duale, Dr. Amin Taker, dear colleagues and friends, thank you for confidence. Life expectancy has increased, maternal and child mortality have declined, and the epidemics of HIV, malaria, and TB have been pushed back. And transition to a new future of sustainable self-reliance based on domestic resources. We also need strong institutions, effective policies, to resources deliver results. The private sector is a critical partner in this effort, from local manufacturing to digital health innovation. For the past decade, AHP has shown that health is central to Africa's development. I commend you for bringing leaders together and turning dialogue into a bond. A healthier, safer, and fairer Africa. I thank you.
That was wonderful, honestly. Now it's my great pleasure to invite my big brother, the CS of Health. You know, I'll tell you one thing about this CS, and many of you have worked with many CSs. One thing, Dr. Duale, honestly, the brutal, honest forwardness that you bring to the Ministry of Health is amazing. And the way the challenges are being managed and how you are able to let the public know that challenges are being handled head on. We really like the way you come out. The way you're managing, also the messaging from your team is great. But most important, CS, the team that is here believe that you also believe in public-private partnership. And when I met you at your office, you were very clear that health is an investment and we have to package it well. And we have to tell the ministries of finance a better story. So as you leave us, we will be discussing on how best to package this message and we get more money for health, but also more health for the money. So ladies and gentlemen, please put your hands together for our Honorable CS Duale to come and address you here, right in Kenya. So if you can please just be upstanding as it comes and we can continue clapping. Because it's a great honor to have your time. I know how busy you are. Thank you, my brother.
Please let's be seated. My brother and friend, Dr. Ami Thaka, the Executive Chair of the Africa Health Business, my colleague minister from Nigeria, representative from Ministry of Health across Africa, a representative of international organization, leaders from the civil society, industry, and the private sector address as I welcome you to Nairobi for the 10th Africa Health Business Symposium. And this gathering marks a decade of bringing together Ladies and gentlemen, over the last 10 years, this symposium has grown into a premier platform where the public and the private sector leaders, investors and development partners come together to challenge assumptions and co-create solutions for a stronger health system. And this year's theme, Health as an Investment, Powering Impact, Sustainability and Economic Growth in Africa, is not just a theme, but is a vision. Our capital stands as a symbol of Africa's ambition. Under our Vision 2030, health is positioned in mindset that must guide us going forward. Allow me to say plainly with utmost emphasis that health is not a cost. We're already seeing the impact of re-engineering our health financing architecture ourselves as Kenya, and our universal health coverage journey, and the targeted interventions across the country. These interventions are yielding real returns in a very stronger, healthier communities, higher productivity, and more resilient economies. We have seen what is possible when investment is sustained and coordinated. The global HIV response showed us that progress is achievable when we act with purpose. Treatment become more affordable, millions gain access to care, lives are saved, and economies recover. Across Africa, similar investments have added years of life expectancy and has reduced mortality. Health investment, therefore, ladies and gentlemen, has already proven itself as a driver of both economic and social progress. At the same time, we must be very honest about the challenges before us. Development assistance is declining, fiscal pressures are increasing at the local level, and health financing gaps remain significant. This calls for stronger domestic resource commitment through better resource mobilization, and when I say fifth administration, that is this administration, is anchored on 4 priorities. Number one, we are building a sustainable health financing system through the social. Last night, 30.6 million Kenyans, bringing universal health care coverage in our country closer to reality. Two, we are community systems, while also building our health workforce, creating jobs, especially for young people and women. And third, we are advancing local manufacturing, including initiatives such as the Kenya Biovacs and the role the private sector is playing in order to strengthen our healthcare security and reduce reliance on imports. And finally, and more importantly, as a country, we are implementing and driving the most robust digital transformation, from electronic health records to the use of data and emerging technologies to improve how we deliver care to our citizens. These efforts are not only about improving health outcomes, they are also about unlocking opportunity. They open up a wide range of business and investment physical, digital innovation, supply chain, and workforce development. With African population expected to grow rapidly in the coming decades, the demand for health making this one of the most important investment frontiers of our time. Ladies and gentlemen, Kenya stands ready to serve as a hub partner for those seeking both impact and sustainable returns through strong and practical partnership between the public and the private sector. We are working to close in play the East African National. I think next time, Amit, you should do that. We are serious members of the East African community. And our East African national anthem colleagues from Africa is more emotional. I love singing it every time I go to a meeting. So I was asking why today we did not play. But next time we'll do it. So our colleagues from the rest of Africa can own. Collaboration is paramount, it's essential. Health challenges, whether they are pandemics, whether they are climate-related risks, or the spread of counterfeit medicine. So the case for investing in health is both measurable and deeply human. The benefits can be seen in economic, but they are also felt in terms of dignity, opportunity, and well-improved quality of life for all. So we must now scale innovate by distinct honor and pleasure. And before I say that, you'll forgive me. I could have stayed here until 11 midday, but when my brother Amit came, and I said that some very vibrant senators have asked me questions. Some of them don't use so, and I have lived there to the discussion. Yes, I will. And my team will be here. So it's my distinct honor and pleasure to officially declare the 10th Africa Business Symposium duly opened. You will be around. It will be a high-level meeting before we go to the World Health Assembly in May. Please, all you're welcome. Thank you, Dr. Dia, my dear sister and neighbor, Dr. Nema, and all the other people. Please welcome to Nairobi, the only city.
Give him a round of applause. Thank you so much. We'd like to go quickly to the cake cutting ceremony, so we'd love you to stay here with us. And my colleague, my co-MC, is going to invite Anmalus Kibacha to come and join His Excellency in cake cutting. You can stand this side for the photos.
And Nishit Shah.
Very good. There's a beautiful cake here. It's for 10 years of Africa Health Business. 10 years, a decade. They say that if you've been friends for 7 years, you're likely to be friends for life. Now, AHB has been here for 10 years. We are so excited about this. We are just about to cut the cake. And thank you so much. His Excellency is going to cut the cake together with our representatives from AHB. There is gender representation as well.
So I would like to ask us to be seated. Let us kindly remain seated. Let us kindly remain seated. Don't worry about the cake, guys. We'll have it. And we're going to have the cake at the break time.
Oh, yes.
Amazing. Are you guys ready? Guys, cut the cameras, guys. Are you guys ready? The symposium. But before that, I would like to recognize our event partners who have made this happen. We have MSD, we have Abbott, we have Roche, Organon, and Connector Africa. Could we give a round of applause for them? Amazing. I'll get to our strategic cut too. But before that, before our first session, I would like to just play a video as we're settling down from one of our partners. Technology tends to show us who's the boss. So as having the video rolling, you can just say hi to your neighbor. I'm sorry, I'm going to make this a little bit like, I mean, you never know. You never know who you're seated next to.
Our video will be up.
We've seen what science can do.
Amazing. Thank you. Thank you, Ms. So, before we started, we had ensured that the whole Africa continent has good health. We'll probably end up saving more money. So the next session is going to be talking about the money. We will be in various countries because we'll have various representatives from different countries. And I would like to call upon this session Dr. Amit Thakur, who is the Executive Chairman of Africa Health Business. Could we give him a nice round of applause?
Holders matter. And I think those of you who are really looking for a new hope of working together with public and private sector in one unison and organizations like this, let's make sure we continue with action. I'm also delighted that on the panel we'll be joined by the PS, Dr. Oluga, who is joining us. But let me invite the other panelists. Salako prepares. Can I also invite you? I'm so glad that my my colleague and my friend, Mr. Zweletu Bashman, who's from MSD, head of SSA. Saloni, please let me know because we've got PS's chair. Zwelu is right next to you, so he can be there. So, yeah, thank you so much. I would like to and the ministers panel is in two tracks, ladies and gentlemen. If you have any questions, please write them down. I'm not sure we'll have enough time to do an open forum for every ways that you see the ministry accelerating coverage. I'm coming to South Africa as well. I'm sure we're going to talk about it.
Health is not a cost, it's an investment. But also to frame it otherwise, we have always been investing, but as individuals. Every household has been investing from a long time. And we want to make sure that this investment bears fruit if we invest as a group, and the government also invests in the health of their people to grow the economy. The ambition of increasing our national budget from the 5 to 9% on health is a journey. I remember we all signed up to the Abuja target of 15%. I'm not sure any country has been able to achieve it yet. About 3 countries. So we want to congratulate those and learn from them. However, in terms of nominal cost, the investment in health has gradually been increased as our priorities from the country, whatever challenges we suffered, are shifting. But government has made serious commitments. When, first of all, the donor funding was going down, Uganda decided to fill all the gaps that they put it to health because we could not wait. Before that, about 2-3 years ago, Uganda had been given a warning that aid is going to stop coming to health because of our previous domestic law. So the starting of realigning financing had already started. Excellent. So whereas we've gotten new challenges, we had already seen this coming. Okay. And so we had used community health workers, improved Jews, community extension health workers being joined and rolled out, encourage local manufacturing of medicines, and insisting that we now move all the money from the global procurements to become local procurements. And also, COVID experience was a good one, because during COVID we realized that there will be no help from coming from anywhere. So what is in country will basically save your country when such catastrophes come.
So Daniel, how are you convincing the Ministry of Finance that more money for health is good for Uganda? Is it an easy task?
It is a very uphill task. In fact, our biggest investment, which the legislators were questioning, were saying 80% of our costs in health are going for prevention. And they're saying we want more hospitals, we want to see more ambulances, we want more buildings to be seen, and we're saying that's not the way to invest in health. Prevention will give us more mileage. Our current budget is showing.
Are you convincing them?
The majority are beginning to convince because recently they increased the financing for health.
There's a difference between paying for health and paying for health care. Maybe the other non-healthcare people want us to pay for health care.
Yes.
And what we are saying is we want to invest in health. Because prevention is better and cheaper than cure.
Yes.
Let me come to our friend from South Africa. You know, Dr. Ramfelene, we have got a lot of news about NHI. NHI in South Africa is creating great news across Africa. Many people here have read about it. I think one of the issues that's coming out that the private sector is well funded in South Africa and pretty strong. In fact, many people have traveled to South Africa for treatment, and they used to go there even more often. But it's serving a small population. So it's a well-funded private sector serving a small population, and you want to bring equity into this space. And the NHI attempts to create that universal health coverage move. What is the current challenge that you would like to deal with? What are you dealing with right now? And what's your message to partners who are here on how we can support South Africa?
Colleagues that are listening, and I've met many South Africans that are here. Firstly, for us to understand the NHI, very simplistic, but we need to state for a fact that we come from a very bad past where, firstly, people in South Africa, they are helped by the depth of their pocket. South Africa spends between 8 and 9% of the GDP on health generally. But it is skewed in that the smaller population of South Africans are benefiting from this bigger chunk. Now, this story is not told very correctly. Let me try to put it, if I can tell it the way it should be.
We're here.
The private sector caters for these people for as long as there's money in the medical aid schemes and in the reserves where they've got the money.
Agreed.
When that money gets depleted, they come back to the state. So the 84% is a fluid number, fluidity going upwards, not downwards. If I have a medical aid today, and it gets depleted, and unashamedly, the private sector will dump me on the state hospital for the state to take care of me. That is why national health insurance is important. To say the resources of the state generated within the borders of the country must be pulled together to care for the citizens. Because health is an investment. The same private sector that would dump me there would want me back as a healthier person to come and work. How I got healthier, it may not be their problem. The last point, just on this segment, there's no one in South Africa who claims to be protected by medical cover who completes a year with a cover. There's no one. Unless even if you're not a sickly person, but once you've got another member of the family who's sick, by August, September, your funds are depleted. Now, where do you go to? So the 84% dependent on the state is a fallacy. Then that number grows up and up and up. By November, December, when the rate of accidents increase, funds are depleted. So what do we then do? We needed to ensure that when we go into NHI, we don't throw quality out of the window, because that has always been an argument. So what government has done is then introduced and established through the Act of Parliament the Office of Health Standard Compliance, which makes sure that all health facilities are playing according to the same standards, so that there's no drop,
whether it's public
standard
or private. They will all have the same standard.
All of them, private, public, if you've got some non-private, non-public sector.
And the benefits package for all of them will be according to the NHIS standards.
They will be according to the standards.
Whether you're paying 50 Rand, 100 Rand, everybody gets the same, whether you're public or private.
That's correct. That's how we want to measure them. But the office must accredit all facilities so that everybody is measured to the same way.
It's like us, PS Oluga here, like the KMPDC. We have 13,000 facilities of 13,500 here, facilities. Nigeria, I'm sure, has many more, and you have many more. But I think you've made it very clear about standards. You've made it very clear about benefit package. What we wanted to just ask you one more thing in NHI. Can I buy top-up cover? If I want to go to a more premier facility, can I pay additional premium to NHI? Or can I pay an additional fee to Mill Park Hospital for my services under the NHI scheme?
When the Act is very clear, NHI Act is very clear, when NHI shall have become fully implemented, there will not be any need for medical aid. Because the question is what you want it for.
Because everything is covered.
Everything is covered.
And for everyone.
For everyone.
That's ambitious.
It's ambitious, and I'll tell you why. It's ambitious because we're saying if the money corner to corner in South Africa could be used to cover everybody for health, it will be, because if you go and pay additional money somewhere, it means, where do you get the money from?
Correct. Out of pocket. Households are paying out of pocket.
If you want to pay out of pocket, you could, but we're saying you can't then have a body called a medical aid that will still cover you.
Contribute to that. So
yes.
Risk pooling.
Yes, yes.
I think your message is very clear. So I'm sure we are going to have more engagements. I'm sure many people have questions around that, but we wish you all the best on that South African journey. Let me come back to you for the second round of questions after I speak to Oluga and Zwelu. But I want to bring my sister here, Asatau, now. You know, Senegal, by the way, let's give them a round of applause. They've got ML3. Are you the only ML3 in this? Oluga, you don't have that yet. Not yet. It's coming. So the next conference will clap for you. South Africa, ML3? Yes? Okay. Uganda? ML2? ML3? Not yet. Nigeria? ML3. Okay, so all these three countries, let's give them a round of applause. But Senegal impresses me a lot because, Asitao, I really like the way you guys are talking outside health and beyond health. I mean, you're at a historic inflection point to me. Oil production in your country is with strong economic growth. And this is creating a generational opportunity to anchor health financing in domestic wealth. This is, again, another idea, whether we start looking at...
Yeah, that is a very important platform for exchange. And yes, Senegal indeed stand at economic, natural resources revenue must be translated into high impact investment. And governance framework have been established to ensure that health remain a core priority in the use of these emerging revenues. We are thinking about not only having a fixed share amount of this revenue allocating to health, but to expand the fiscal space for health and ensuring that those revenues will be allocated to high impact investments, including in primary health care, which remain the foundation of any health system that is proceeding for universal health coverage, but also in investing in workforce, health workforce, and investing in which is developing local production of pharmaceutical products.
With the finance ministry, are you finding a time, let's say you put a tax on oil, or you put a tax on, like Ghana has done 3% health tax, or you tax VAT. When the funds actually get circulated to the treasury, do they ring fence what belongs to you, and do they give it to you, or do you have to claim it based on services? Do you automatically get those funds?
In Senegal, we currently don't have fledged revenues for health, another sector. It's mixed.
So you only get allocation as per budget, but there's no ring fence budget for health.
No, there is not at this stage.
Fundamental acts, even in the early days of this administration. And what healthcare? Then we did social health insurance fund. We did emergency care. Maybe, Oluga, share your journey, what you feel were important steps to pass new legislation to strengthen institutions in our countries so that you can get better, stronger health domestic financing and better health service delivery.
Thank you. Thank you, Amit, and all our colleagues from Africa. I can see my good friend Salako. We've been in a number of panels together. And good morning to everyone. I want to ride on the speech of my minister. I think he was here earlier opening, and he painted to you the picture in terms of our health financing architecture, and particularly the resolve of the country to place healthcare as an economic transformation pillar. And I think that underpins the principle of health financing that we have, and also the journey that you talk about. And I think just before I answer that question, we are also extremely in the African continent because we are all undergoing the same journey and learning from each other. Just recently, Ghana was here, and before a lot of exchanges with Zimbabwe, Malawi, and all the African countries. And we are very committed as Kenya to share our experiences, to share our journey, but also to learn from where is the money coming from? And I think that is the make or break of healthcare financing. As you have seen, we can talk whether we do prevention, but you still have the problems. Like you can talk about preventing cancer, but today as we speak, somebody has cancer. So you also can't abandon them. So you still have to have legislation. And really the journey starts by the citizen being convinced that I can participate, I can meet government halfway, prioritize and provide and pay for the care. Also, because of our many laws, the PFM architecture, the way money flows within the public sector, the answer is also not always as easy, okay? So that brings us to how then do we meet this halfway? And that is through contributions. And so we have entered that journey discussing with citizens. And when I talk about the citizen, in Kenya generally we have 3 categories of our population when it comes to income. We have the 20% who have formal income. They are either employed or are in business. And those businesses are formalized and you can predict the income, you can know the amount.
Yeah.
And that is because His Excellency the President went around the country to every county and held these town halls, and people participated and said, all right, if this is the scenario, I am willing to do it. It starts with that. And then it goes, of course, to Parliament, and then Parliament then passes it into legislation. But then there is also the other segment of Kenya, the 40%. They have what we call informal businesses. They sell food sometimes on the street, or they run the motorbikes, we call that boda boda, or, they are involved in some form of activity. They are farming goats or something, They are not necessarily poor, but then that income is also not structured. It's not consistent. You can't say that it comes every month. And so the question is, how do we get them to participate? Right. And that also we have established a mechanism in which they can pay as per their ability. Now, of course, that is still, they are either in rural places, or they may not be having income that you can rely on, or they are perhaps indigent, or they are vulnerable because of disability, or a number of people. So that is really the architecture of where does the money come from, because you must answer that question. Then, of course, there is the discussions about what do you do with the money, and that what is ailing Kenyans more, what is making them lose more money through health,
Sure.
what is making them die, and how then do we prioritize all of this in our benefit package to answer the question, what do we do that we've collected? And I think that is the simplest explanation of our healthcare financing architecture.
I think you've made one message very clear, that you should...
If I was sitting on this panel maybe 5, 10 years ago, I would have felt very intimidated, in the sense that I think the spirit of collaboration between government and business was not as well developed. We've come a long way, and ideologically, as business and government, we actually want the same thing. I always say to people, in all my engagements, I seldom alignment is there. And so when we speak about how to approach this issue, it's always grounded in there was a very jarring sort of throwaway comment for me, or with me, in the work that we do. And they said, nothing is ever free, even when it is free, because someone is paying. And I had to sit and kind of think around that, and think around how I can utilize that to benefit the African continent. And that's why we do our work slightly differently to many other organizations. And I think the critical thing for us is partnership is key, and it requires an all-of-society approach. And we'll start with, if we're talking using breast cancer as an example, first and foremost, there needs to happen sort of collaboration around awareness, education, etc. And that collaboration is ministries of health, healthcare practitioner societies, manufacturers. What people don't understand often when you look at pharmaceutical companies, probably upward of 90% of what is termed our promotional budgets actually goes towards healthcare practitioner education. Platforms such as this. This is what we do, and we do the lasting impact in building awareness, educating the healthcare practitioners, and the immediate term. But we are conscious that healthcare, as everyone has said, is an investment. So we have to put in our dollars now to generate a sustainable market down the line.
Sure.
And so I think the one thing that we need to do, though,
right,
with more purpose as a continent,
is pooled procurement and leveraging expanded access programs that are grounded in shared value principles.
Excellent.
It's exactly what NHI
Yeah.
is, or any other universal health coverage. And what we need to do there is, number one, leverage inter-country volumes. And I
Right.
know the Africa CDC is looking at this.
Right.
But also leveraging intra-country volumes. And this will allow access across multiple tiers of affordability within the three. And I think Nigeria with the NCAP program and NCHF program have literally hit the nail on the head. And I always say, but how do you know?
Right.
And an interesting example of how this works is we've got Health Equity and Partnerships unit within our organization that focus unit that she leads.
Yeah, the work she does.
They did
in
incredible
Maltex.
work in Indonesia, where over a 5-year period, managed to secure just under $1 billion in financing. Why? We started working with the government and realized that they wanted to expand HPV vaccination to adult women as well as boys.
Okay.
For us, that meant that, okay, you're expanding the market, we're getting broader reach from a patient perspective. So there's a financial sustainability there.
Yeah.
And then we lobbied that investment case across multiple financiers until we managed to find the financing that was going to drive this project along. And that's
Of difficulty, private sector accessing government. I think we have all experienced that. And you and I have talked about some of these issues. But there is also sometimes progress what the private sector is saying. And because, government is structured based on certain processes, the private sector often just looks at the end goal, like I'm bringing for you some very innovative product. Why are you not taking it? But then the decision structure within government is based on a process that has to be verified, approved, and all of that. So we in Kenya have solved that problem by establishing the health policy platform that then can curate and look at these innovations and ideas and then pass them through that pathway, whether it's going to be a policy or a scalable or an access program. And this is really the offer that we want to put here, the health policy platform, which then becomes the coordination mechanism, also to an extent the financing in terms of structuring non-state financing so that we
Excellent.
align with the one budget, one plan, one
Are
endeavor.
there any members from the health policy platform here?
We have just done this from December, and we
You're
are in the
building on it.
process of now rolling it out.
Excellent.
And I think that communication is going to come to encourage everyone to participate through it, private sector, NGOs, non-state actors, so that we democratize policy participation and participation in the
It's
in the health
institutionalizing
system.
it.
Thank you.
I want to really, I'm getting pressure. Salako, go ahead.
Well, thank you very much. It's just for me to make the point that, from my experience, the private sector is, and you give some level of assurance of continuity of patronage. So, and also, if you also create some level of enablers that can help investment to take root very, very quickly. So I think that in discussing and engaging the private sector, those are very important elements that as governments we need to look at. How do we ensure that we give some level of guarantees? How do you provide the enablers that will fast-track investments so that, because ultimately you find out that domestic investments do not automatically translate into cheaper services if you do not provide those enablers. So I think that's one key important message to them. The policies environment are very important to help drive investment at the domestic level. Thank you.
Absolutely. Ladies and gentlemen, let's give them a big round of applause. And can I please ask you to be upstanding in the front for an official picture as we get the panel B ready. Did Thank you so much. And I think panel A, now panel B, I have my colleague, Dr. Mary Musa, who will be helping on this moderation. So Mary, you have some interesting people from different countries. So you can see who you have. Can you put the slides up?
So I believe it's still good morning, ladies and gentlemen. Thank you, Dr. Amit. And thank you, I appreciate. So a small change in the program. I can be replacing Dr. Amit sometimes, you will see. So I'm the younger, more fun version of Dr. Amit Thakkar, I would say, with more hair as well. So thank you, we appreciate. I would love to welcome from my home country. I left Egypt 12 years ago and I moved to East Africa. I worked across East, Central and West Africa, but I'm very proud to have the motherland presented. Dr. Hatem Amer, the Associate Minister of Health and Population for International Relations, Ministry of Health, Arab Republic of Egypt. Next would be actually our colleague from Malawi, and I have interacted and worked with her, and we do appreciate her efforts always, and she will be sharing the Malawi experience. Emily Chirwa, ladies and gentlemen, please a round of applause. Next, I would love to call on Dr. Ebongo, the Director of Family Health, Ministry of Public Health in Cameroon. Dr. Last but not least, Mr. Neil Shah, the interim country president for Africa cluster, AstraZeneca. Mr. Neil. Diana, I owe you an apology, so maybe I'll take you out for dinner later. I did not forget you. Diana Kiza, ladies and gentlemen, the Health Financing and Access Evidence Partner at Roche Diagnostics. Diana. Thank you. So, not for prejudice or maybe favorism, but I would start with you, Dr. Hatem, and thank you so much for making it, and we say Karibu, Kenya. Before I ask you a question, I want to make sure that we align on the goal for the symposium, and that is sharing exemplars from around Africa, sharing success stories, and align on ways of collaboration. Before we leave the symposium, before we leave the 2 days, we need to have secured clear ways of PPP. We need to have secured clear ways and understanding and also learnings from around the continent. We are not lacking expertise, we are just maybe lacking collaboration and networking and connections. Dr. Hatem, Egypt has been really trying to achieve the UHC. We have made some advancements. It's not 100%, but I think I would love to hear from you, and I think for our colleagues as well, what the country has done so far in terms of putting together solid investments that are sustainable and scalable, and how you dealt with the inclusion. We heard Dr. Uluga earlier talking about the informal sector. I would love to know how Egypt has actually included both formal, informal sector, and how the taxation also parts our
the Kenyan government and of course our dear friends at Africa Health Business for having us here. And I would just like to begin by setting a very important scene, is that the official development assistance for Africa has went down by almost 70% between 2021 and 2025. So I think this is a very important push for us and a sign for us for Africa to build locally, depend on our minds, on our capabilities, on our people, and to jointly cooperate to make sure that we achieve, as colleagues have mentioned earlier, and as we always do, the Africa we'd like to see and achieving our Agenda 2063. Now, to bring it to Egypt's context, I would like to point out that it's very important that you have very high-level political commitment. And I think this is the driving factor for Egypt's success in the past few years when it comes to healthcare reform. Our healthcare investment has quadrupled between 2018 and 2025. We have a very strong mandate in Article 18 of our Constitution for healthcare access and investment. And also to make a strong argument is that you see that the investment that Egypt has made, for every dollar that was invested in healthcare, the return on investment was between $10 and $35. So that is a very clear sign, proven. You see it on the ground that you invest in healthcare, you help develop your people, you develop society, and you maintain sustainability on the long run. We were also able to, through a lot of policies that were implemented throughout the past 6 years with the launch of the new universal health insurance. Also to paint the scene, Egypt is a large country, third largest in our continent with 120 plus million people, plus almost 12 million migrants and refugees living with us in our country, and as the president always refers to them, they're guests. So that is a huge burden on healthcare, and investments had to be increased, and we aim to decrease out-of-pocket spending, which we were able to do when we launched the Universal Health Insurance Law in 2018, by almost from 60% spending to 24% spending in the initial 6 governorates. And also, we phased it out. It's a phased approach. We initiated with 6 governorates with a total of around 5.2 million people. We've included 6 other governorates 2 years ago with an additional almost 13 million people. And we've seen that within those pilot states, governorates, the 6 initial governorates, we were able to decrease out-of-pocket spending, increase evident return on investment for what the government invested, inclusion of private sector. They're a main contributor, a main partner, whether you have private sector hospitals, private insurance, the pharma industry. It's it's not, the government sees and knows that development is not a one entity progress or marathon. No, it is the inclusion of all stakeholders. And another thing that has played a very important role in the success thus far is the good governance and complete each other, but with different mandates. So unlike prior to the 2018 law, where you had the Ministry of Health and healthcare provision is definitely a priority for Egypt's leadership, for the government, increasing spending from 23 billion Egyptian pounds to 120.
Bringing also different institutions, governmental institutions together, collaborating with different stakeholders together to achieve UHC. How can we replicate that model of the interministerial?
The honor and the opportunity to speak on this panel on healthcare financing. Madam Moderator, as you rightly said, Cameroon flagged off in 2017 during his usual end-of-year address to the nation. The President of the Republic announced the institution of universal health coverage for co-budgeting and co-planning and co-financing. So, and on that, while we progress gradually to the full package, which will respond adequately to the definition of comfortable and does not go into the definition of universal health care, whereby everybody should have full health coverage anywhere. At in April 2023, the national launch was held. And as you said, there should be accountability, and transparency. And this is setting digital platforms for health management, like Open IMEs and Prop IMEs, whereby everybody on the platform should be able to see whatever is coming in and whatever is going out as claims, and whatever sources of revenue are generated. And mark you, Madam Moderator, we are here leveraging on the benefits of PBF, which gave us so many lessons, which taught us so many lessons, because from PBF, I think countries that practiced it will realize that it was out for quality and also for, for patient satisfaction. So in Cameroon, we had 6% quality improvement and overall 30% patient satisfaction, which, was used as a stepping stone, as a platform for us to leap into universal health coverage. Of course, PBF was like some sort of health insurance, which is just a subset of universal health coverage. So in that platform where we are all discussing, we talk to each other, with all the stakeholders, the members of government are there. The parliament this first phase, which for now has to put all the necessary administrative and management tools in place in preparation for the second phase. So share with you that there are very many. Cameroon has a multi-actor mechanism for financing it, right down to even the person on the street. Some informal, methods for us to be able to reach out to the person on the street. It might not be 100%. We are just taking off from the first phase, but we are moving gradually to achieving global universal health care for the country.
Thank you so much, and it is inspiring to hear what the country of Cameroon is trying to achieve and seeding to achieve. And I think transparency is very important to encourage the taxpayer to keep supporting the government different ways of trying to finance healthcare schemes. And what is realistic? Our promises to the people to be realistic based on what we can support, and most importantly, to include the private sector. Diana, I want to actually to gradually move from simple access. Actually, they are not simple. They are tough to implement, being implementers ourselves. From access programs to scale.
Thank you so much. And thank you for having us here. I think it's very rare to have platforms where we're all gathered together to really show how much our incentives are very much aligned. I think everything that's been mentioned here is really critical. One of the things we've learned around partnerships is that it's important to show the transparency on our part that we're moving beyond just diagnostics. And we understand that the shock in financing has not only affected governments, but even the patients that we all serve. And so a couple of things that we're doing to ensure that, we all ensure that the patients actually are able to still get some of these medicines is we've learned that we need to change the way we speak and the way we advocate in these partnerships in terms of what are the cost effectiveness, what is the value of diagnostics that the ministries of finance and whoever holds the budget sees. So for one diagnostic, let's say you're looking at HPV DNA, the cost of hospitalization just from diagnosing early, treating early, and capturing this disease at a very early stage is huge. And those are the kind of figures that ministries of finance want to see. That's one. Beyond that, I think it's also important for us to partner with existing systems within the government, existing financing systems. So we're very keen on looking at the essential diagnostics, the standard treatment guidelines that governments already have. And instead of pushing something totally new, we partner with you on your core political priorities to ensure that we can show governments proof of concept around how to drive down cancer cases in your treatment programs. Partner with you to ensure that we can achieve those initiatives in moving forward. And then the last piece is around how we do what we call public-private partnerships. I think a critical thing that we've been able to do is help de-risk some of the infrastructure costs that governments have to lay down. And we are able to offer platforms and our equipment in a manner that allows government not to pay directly, one, help you with your maintenance so that that's not a problem for you, and you can focus on just ensuring there's awareness and use of the equipment that we have. But last and least is we also realize that governments are very keen now, because of the reduced resources, to understand how do we now find efficiencies with the little money that we have? How do we show the Ministry of Finance that we're using our resources well? Many of the platforms that Roche has, as a quick example, are able to do multiple tests. In the past, funding was fragmented. And because the funding was fragmented, a TV program could not do an HIV test, even if the same platform could do it. But our platforms are in place. You don't need to invest much more in infrastructure. So let's partner now to see how do we support the integration initiatives that you do have as countries to ensure that we are able to provide the solutions and the platforms for you then to build and showcase efficiencies transparently to ministries of finance. And again, just speak that language around value of diagnostics moving forward and how that really does bring down the cost for the health system as a whole, but also builds public trust with patients as well to use the health systems that are available.
Thank you so much, Diana. And we are actually proud partner for Roche, and we are very happy with the work that you are trying to do and consistently proceeding to do around the continent. Maybe my next question, and please don't hate me if I give you sudden questions or I look like I'm ambushing. I'm hoping that we can all benefit from the conversation. So Emily, you have to forgive me for this one. My next question, and I love how Diana has mentioned that she's dear. And that means the private sector actually trusts the government. And we want to show, as Honorable Salako has mentioned, we want to show the private sector that the government also can be committed, can be reliable, beyond the donor support. Malawi is a very special country, and I think we need to discuss how we are going to move the current systems and the current financing from donor dependency into domestic. And domestic doesn't necessarily mean the government alone, and that's why we are here. We are trying to say that the private sector got your back as well. The multilaterals, the African agencies are here to support because we are all one Africa. So Malawi, and Emily, correct me if I'm wrong, I think Malawi was depending on aid for health by 70 and 80%. And just to share with you, ladies and gentlemen, and also to capture your attention, and if somebody in the room also have different data sets they can share, the previous USAID has been covering lots of, not only health, but also infrastructural development, education, so on and so forth. A country in the global south that is called India has refused to rely on USAID as the major health financing agent. And instead they said, put your money in our infrastructure, put your money in our development, put your money in our workforce. We haven't necessarily done that, and we need to know how now to mitigate the risks that those dependency decision has put us in. Emily, how Malawi is doing, how the country is doing, how the Ministry of Health is planning for a transition towards domestic financing, and how the private sector can come in.
Thank you so much for this opportunity, and thank you to Africa Health Business for this symposium and the opportunity to share the Malawi story, and thanks to all the participants. Yes, maybe, just a minor correction on the figures. Of course, unfortunately, in terms of our data, we are quite behind, and this cuts across in Africa. For national health accounts, because this is what now gives us how much we are spending on health. This is where we calculate the total health expenditure. Most of us are behind. So I think the last one that Malawi did, that was in 2020 to 2021. External financing went down from 67% to 54%. So currently people are on the ground. We want to collect data up to 2025-26. So we want to close the gap in terms of our data, because it doesn't make sense talking to Ministry of Finance using data as behind us 2020, yeah. So, but currently we are still using the 54%. So it's been going down. Yeah, so what are we doing as Ministry of Health to make sure that we increase domestic financing? I want to mention that Malawi was the first country in Africa to hold the health financing dialogue. So this is something, for me, I think it's one of the best things that has come out of the AU through the Africa Leaders Meeting, whereby countries now, our leaders have now seen that our brothers will never be there forever. You know, it's good to have a brother that holds your hand in terms of trouble, but it's wisdom to know that this brother will never be there forever. And it's good for us to start planning. I'm happy that we're having these discussions now, but I really wish we had had these discussions in the 70s. By now, we should have had an Africa that is resilient. If we want to talk about sovereignty and security, we should have been there by now, but it's okay. It's never too late to make the right decision. So within the Ministry of Health, when we have the dialogue, we met Ministry of Finance, we met private sector, we met our partners, we met civil society. And in that dialogue, one thing that I learned that helped us as a ministry to make headway was the use of the data. So it's important for us to make sure that we put our houses in order as the ministers of health. We need data that talks. Data will always give the real situation. Data will never lie. So when we met ministers of finance, there is this perception, I believe it is in all countries, that usually when ministers of finance know that we've got Gates in the Ministry of Health supporting us, when they hear about the World Bank, Global Fund, they feel like we are okay. But we told them that through this data, we are only spending $40 per capita instead of the $86. So we are actually spending way less than the required amount, even less than the 50% of what we are required to spend. And we also showed them that in terms of our medications, our pharmaceuticals, it's Global Fund, US government, procuring for us HIV, ART drugs, TB, malaria. And we were honest to tell them that, you know what, the day these partners are going to pull out, we will die like chickens in Malawi. And I think this can happen in Africa. If we don't pull our socks, we will die like chickens from malaria. We will die like chickens from HIV and AIDS. We will die like chickens from TB. So what do we do? Because for us, over 90% of our pharmaceuticals is externally financed. And the moment these partners are pulling out, it will be a disaster for the country. Yeah, so through those discussions, we have seen the ministers of finance moving. We have seen even our Abuja targets making progress. But we also sat down with the private sector. So we said, let's sit down here. You need to support us. We need to work together. Most of the times when we are having these discussions, when we are talking, we usually talk as if we are planning for a third party. But we are planning for ourselves. There will be a day that no one will be able to airlift us to India, to Europe for treatment. We need to treat ourselves in our own countries. Most of us, I'm looking at you guys here, we are going towards our retirement. Who will pay for our medical insurances? Who will airlift us? So we need to make sure that we have systems that will be able to save ourselves, as also the systems are saving people in our countries, our brethren. So us who have this privilege that we went to school, we are learned, we need to sit down seriously and now move from the talk and implement. So we have sat down with the private sector in Malawi, and one thing that we have learned is that we also need to put a house in order. So we are working on coming up with bankable projects. So actually, now we are working on doing feasibility studies. There are projects that we are implementing. We want to have centers of excellences in Malawi, so that if somebody has got a cardiac issue, we don't need to airlift them to India. They need to find it to be treated in Malawi. And this, we are also expanding it for private sector within Africa and even outside to come in and support us. I had a meeting with Roach yesterday, and I was saying, I guess it's high time we need to look to private sector as government, as partners, and not suppliers. Because usually when you have an email, someone wants to talk to you from the private sector, you feel like, what are they selling? Do I have the money to buy? Yeah, but we had a very good discussion with Roach. They are our partners. So we need to look at the private sector as partners. We sit down on the table. As government, we also realize that the private sector, they need to survive. They need to make profits. How to work together so that they are also able to make their profits. But on the other hand, the private sector, you are here. You have you do corporate social responsibility. I think it's high time we need to prioritize health. How best can we work on that? How best can we share with you our priorities as government, so that when you are planning for that CSR, you know what government requires. So I look at all these things as a partnership. We have actually formed a forum whereby we meet private sector within Ministry of Health. It's a technical working group, so we meet all the private sector. We are sharing them our plans. We are currently working on a compendium of investments, bankable ones that private sector can also invest in. So there are a number of initiatives that we are planning. I can talk the whole day, but I think I can share this for now. Thank you.
Thank you so much, Emily. And we will talk the whole day. We will talk today and we will talk tomorrow, and we'll make sure to provide all the channels that ensure that the private sector is there to support. And we are trusting in the leadership of Malawi and the Ministry of Health as well. Let me go back to a point that you have mentioned, and that's the historical support of donors to what we have thought is the major issue of healthcare, which is HIV, malaria, and TB. Statistics are telling us that the prevalence of diseases and the killers currently in Africa are no longer those three. We are having a rising burden of NCDs, having a rising burden of hypertension, diabetes. Egypt is suffering from diabetes hugely, and I think it's expanding to the rest of the continent as well. We have a rising burden of oncology, where we also find our patients in late stages, and that increases the mortality. And I always said, for NCDs, nobody is going to come and save us. It's actually our government that is responsible, and one more partner. That's the private sector. Unfortunately, NCD does not travel. So it's of nobody interest. It's our own sovereign and domestic health security in the continent. So we need to take care of that rising burden. And that takes me to a question to you, Neil. And you have been pioneering the fight against NCDs and the awareness campaigns in many countries. How are you bringing up those statistics and that burden to the countries that you're partnering with, ministries of health that you're partnering with, the population that you are trying to serve and give access to proper treatment for? How are you scaling up and also bringing the information to them that this is actually the current risk? It's not HIV anymore, it's not TB, it is there, but we are dying faster and in a more brutal way from NCDs. Neil.
Thank you very much, firstly, for inviting us and for inviting AstraZeneca to be on the panel today. Yeah, I think you're very right that NCDs have surpassed the communicable diseases, especially in terms of the burden of care in Africa. And AstraZeneca has, for many years, focused on NCDs in Africa through our health equity initiatives, where we've focused primarily through one of the programs, which was Healthier Out Africa, which has been running for over 10, 11 years in about 9 countries, and Cancer Care Africa also for about the same amount of time in Africa, where we bring awareness and education and learnings, and from an oncology perspective, basic diagnostics in terms of diagnostics tests and capability building. It's not an easy road to try and focus on NCDs in African countries that has so many health challenges. But you've got to recognize the impact it has, one, on the health ecosystem from a cost perspective, if you don't catch it early enough, if you don't diagnose it and screen it early enough, and beyond that, from a productivity perspective in country. And it's been a common theme. And as AstraZeneca being part of the private institutions, we've actively engaged and worked with the ministries of health across all of these countries. And it takes a long time to get MOUs signed, and especially since health equity sits outside of a commercial ambition. It's a separate, to what Zweli said, we also have a separate division that runs that. But it's to give back to the people of Africa. Part of those learnings is, how do you get real-world evidence? How do you get simple data? Because the challenge in Africa is data. We are so vast, the countries are so vast, the primary healthcare clinics are so far spread that you don't get real data to support the narrative of what is the impact on the population. So as AstraZeneca, we've spent a lot of time adopting digital and AI in a lot of these initiatives, because from a diagnosis perspective, it's probably the quickest, maybe not the cheapest, but the most effective way of gaining coverage over vast geographies. So we've really, and it's part of an ambition that we have globally, to adopt digital and AI technologies, everything from diagnosis to screening, and even in terms of some form of patient care. That gives us scalability. And it's a mind shift change. It's changing government's perception of where healthcare sits. Emily mentioned an important point about we're in the business to make money. We're in the business to make money responsibly, because as industry, as AstraZeneca, we contribute a lot back in these initiatives in order to make sure that we can sustain Africa. Just Healthy Out Africa, over the last 10 years, we've screened over 60 million people in Africa. We've put about 12 million people into the system from a care perspective, and we've trained over 11,000 institutes in 49 countries. And that's a commitment that we've always had. How do we work with government? What do? We work not only with the ministries of health, we work with the ministries of finance. We see them as partners. We see them as integrated in terms of how do we move from project to long-term scalability. Because that's the biggest challenge you have with all of these initiatives. Well, donor funding may not last forever. How do you bring it back to local governments? How do you then find a way to transition it into the ministries of health so they can sustain it? And it's about providing that evidence, collecting that data, and showing them what you've actually done with those initiatives. It's working with them on a continuous basis to see how do you then formulate a transition plan so that they can eventually build it into their budgets. And budgets specifically around those disease burden as part of the healthcare expenditure, because then you'd secure the workforce behind it, the systems behind it. And systems are very important. The biggest challenge we've found is helping establish those right systems and architecture within these countries. And we've done that consistently, and we work on one country at a time, and then we scale up to other countries as we learn, and we apply those learnings. In that way, we can support local governments in terms of firstly diagnosing and then screening individuals and bringing about better care. And that's what we've been doing consistently over the last 10 years.
Thank you so much, Neil. And we're urging you and all of our partners in the room to continue actually supporting. It is your time now to show that you are a reliable collaborator. You are a reliable partner. And not only to provide diagnostics or commodities, but even as a technical arm for the ministry, helping us to present this data to the Ministry of Finance, help us secure that domestic financing, help us have a transition plan. And I think this is also an important role for the private sector and collaboration with the public sector. I'm really glad that we're having such an open conversation and that we are building towards practical collaboration and alignment. In the next session, we will be talking more about diagnostics, and we'll talk more about how the DALI and the health economics are different in Africa than any other continent. By the way, we'll explain more on that. But maybe after we actually finalize with our session, and before I thank you, we want to talk to Dr. Hatem afterwards. And because, Emily, you said in the 70s we could have been a different Africa. It's a very important point, because there are lots of countries that have transitioned from government-based model to an open market where the private sector came in as well and took part of that burden. And I think Egypt is one of those countries where in the 70s we decided to have an open market and let the private sector in. It's very important to understand the politics around it, the finances around it. Health is not a standalone, so I'm encouraging a conversation and a catch-up after. But with that, ladies and gentlemen, I would love to thank my panelists. Thank you so much, not only for your insights, but for your continuous support to your countries, to your governments, and to Africa. Thank you. Thank you, everyone.
How are you guys feeling so far? A bit hungry? Okay, don't worry, don't worry. So, we are about to go for break, and I'm only giving you 15 minutes because we've gone a bit overboard. I think the money discussions were a passion topic, yeah? So I'll allow us to go for break for 15 minutes. There's tea served just outside this door. If you also make your way to this side, there's tea also served. So that means I will be expecting all of you in, let's say around 11:20, yeah? So feel free to connect, interact with, the people over a cup of tea.
Oh, yes.
Additionally, we also have our partner Zuri Health, who have a mobile clinic outside. If you're feeling a little bit, feel free to pass by their mobile clinic and get checked too. Amazing. See you guys in the next 15 minutes.
See you guys. Give your neighbor a high five as you're leaving. Please high five your neighbor, high five your neighbor. Come back to that energy in the next session. As you can take down. See you healthy. Get Let us move quickly into the break session, please. Let us have these conversations as you are having your tea. We only have 15 minutes so that we are back in the room. Kindly some movement. Let us leave the room so that we can have our tea. We are back here in 15 minutes. When you hear the music, well, you come back. Thank you.
Thank you.